A group of researchers took a look at some of our reporting recently on UCHealth's habit of suing thousands of its own patients every year. They were wondering if they could replicate the findings of our 9 News Investigates team. In the end, those researchers ended up concluding, well, what our Chris Vanderveen had already realized.
For years, the largest provider of healthcare in the state was also its most litigious, suing patients by the hundreds every quarter until one quarter in early 2020, the lawsuits appeared to disappear. That is, until we found them hiding by the thousands within the state's court system.
I get sick. My blood pressure went up because I get scared.
Instead of suing patients like Lorena under their own name, UCHealth began suing patients under the names of one of 2 third-party debt collectors, a practice that made their lawsuits nearly impossible to track.
Why did we come to Colorado and do a deep dive on UCHealth? Well, it was really because you broke the story.
Cynthia Fisher heads Patient Rights Advocate, or PRA, a nonprofit fighting for more transparency in healthcare pricing. Following 9 News Investigates reporting last year, PRA joined with researchers at Stanford and George Washington Law to see if they could verify what our investigation found. Spoiler alert, they did.
I mean, it was so hidden that some of the patients didn't even know when they were sued for debt that it was medical debt.
By using third-party debt collectors as the signed plaintiffs on their lawsuits, UCHealth, says the report, attempted to conceal this, that it remains the state's largest initiator of debt collection lawsuits against former patients.
We found that they were an outlier and that they were extremely aggressive in their practices.
Often, the lawsuits resulted in requests for wage garnishments. More than a third of suits brought by one debt collector resulted in legal requests to take home a percentage of the defendant's pay.
Hospitals do a lot of wonderful things, and a lot of really heroic people work there, but they also are causing a lot of harm, and they simply need to fix that.
George Washington Law professor Barack Richmond helped author the study. He says the report tells him UCHealth didn't just conceal their lawsuits. They actively confused patients along the way.
We found, and your reporting, your terrific reporting has found, that patients just don't understand the bill. And that's because nobody understands the bill. The bills are totally ununderstandable.
In a statement, UCHealth called the study misleading and based on data that is up to 6 years old, adding 99.93% of all patient accounts are resolved without any issues. It's similar to what UCHealth told us last year when we first exposed the practice.
99.9% of our patients get through the process without any involvement from a collections agency or a court.
Also last year, and following our reporting, the state legislature passed a law effectively putting an end to the hospital's practice of suing under someone else's name. From now on, if UCHealth or any other hospital wants to sue a patient for unpaid debt, it must put its name here. Chris Vanderveen, 9 News.
Spokesperson for UCHealth also told us the nonprofit hospital system has improved its processes to minimize some of the billing errors we've identified in our reporting. Important to note here, while some other hospital systems in Colorado do sue patients for unpaid bills, the largest for-profit system in the state does not.